Internal signs, that is, neck and its structure, should be examined after the removal of the brain and chest organs to allow blood to drain from the neck blood vessels. There may be superficial hemorrhages under the ligature mark, though this is often minimal. There is severe engorgement and hemorrhages into the tissue in and above the area compressed. The adjacent muscles of the neck are usually lacerated. The deep muscles of the neck the deep muscles of the neck shows little or no bruising. If the ligature usually soft and yielding, some cases non-external mark is seen on the surface of the neck, but extensive bruising of the deeper tissues are found. Maybe found. Extent of the bruising depend upon the extent, but extensive bruising of the deeper tissue may be found. Extent of bruising depends upon the degree of pressure applied. The degree of pressure used. Right? Ligature which is tightly applied on the neck until death occurs may fail to produce any bruising. Subscapular and no bruising in the extensive bruise and deep muscles, there will be no bruising until up to the death. Subscapular and interstitial thyroid hemorrhages are common. The mucous membrane of the pharynx, pyriform sinus, epiglottis, larynx are usually shows area of hemorrhagic infiltrations. Lymphoid follicles at the base of the tongue and palatine tonsils are congested. The posterior lingual mucous membrane, some maxillary parotid glands may be studded with a petechiae. The intima of the carotid arteries are not usually damaged, but a deeply sunken narrow ligature force applied with the force may damage the carotid arteries. Bruising of the root of the tongue and floor of the mouth may occur. Hemorrhages may be seen under the mucosa of the larynx, especially beneath the vocal cord, as a direct result of compression and due to stasis of blood rather than the asphyxia. These hemorrhages are larger than the particular hemorrhages of asphyxia. The larynx, trachea, and bronchi are congested. Larynx, trachea, bronchi congested. Contain frothy, often blood-stained mucus. False hemorrhages may be present in the back of the esophagus and on the anterior spinal ligaments. The carotid arteries are damaged if a narrow ligature is applied with the force. Lungs are markedly congested and show ecchymosis and large subpleural hemorrhages. Silvery looking spots under pleural surfaces due to rupture of the air cells which disappears on pricking are seen in more than 15 verses. Due to putrefaction of gas formations, bulla will slip under the fingers if it is smoothed being subpleural, while the emphymatous bulla is will not. Pulmonary edema will be from putrefaction as a bulla will be slip when we use a finger, but in emphymatous bullae there will be no slippage. Okay. And pulmonary edema may be present microscopically. There is intense intra-alveolar congestion. Alveolar congestion with the hemorrhages of various size fluid in the alveoli. Their passages contain very large of desquamated respiratory epithelium. Red vessels fluid. Parenchymatous organs may show venous congestion. In young person, ecchymosis are usually seen on the Heart and kidneys, brain show congestion and show petechial hemorrhages. Injury to the hyoid bones are not common because the level of constriction is usually below the bone. The ligature is wide and sometimes fracture may occur. In older person, fracture can be caused by direct lateral compression of the sides of the neck, by pressure applied high under the angles of the jaw, indirect violence, in which bone is drawn upward and immobilized by various muscles are attached to its upper surface when the neck muscles are contracted in an attempt to resist strangulation. Fracture of the thyroid cartilage is more common, especially over the one or both superior horns. Fracture of thyroid lamina and cricoid cartilages is less common than in throttling and may occur when considerable force is used or if some solid object is included in the ligation applied over the front of the neck. Trachea is rarely broken. Thank you.